In this video, we're going to go over the core stabilization exercises. So Alex is here and he's going to go over what I call the drawing exercise. So just laying down here. We're on the mat table, so we're not down on the floor, but if you're with your clients in the gym, obviously you can do this from the floor. I have this mat underneath Alex's head. Basically what that does is help bring the rib cage up a little bit. It helps to prevent the muscles on the outside of the core, the rectus abdominis muscles, from overactivating and doing most of the work. So we're really trying to isolate the deep muscle of the core called the transverse abdominis. So what Alex is going to do, drawing exercise, it's a little confusing at first, but after you go through it a couple times, it gets a little easier. Okay, for now Alex is just breathing naturally. First thing he's going to do, without changing his breathing pattern, so he's not going to inhale, his rib cage isn't going to elevate, he's just going to breathe naturally. And he's going to pull, using the deep core muscles, he's going to pull his belly button down towards the spine, so pull in as far as you can go. From that position, without inhaling, he's going to forcefully exhale, so push all the oxygen out of your lungs and push it, pull in even tighter. Hold for 5. Remember to breathe, shallow breathing. 1001, 1002, 1003, 1004, 1005, and relax. Okay, very good. One of the common things you'll see when people do this exercise is they'll hold their breath. So you want to give them the cues. You don't want them to hold their breath. You want them to continue breathing, do shallow breathing. Okay, so we're going to walk through that one more time. So he's going to breathe naturally. Without changing his breathing pattern, he's going to pull his belly button down in. Forcefully exhale and pull in tighter at the same time. Hold that belly button down for 5 seconds. Continue to breathe, shallow breathing. 1001, 1002, 1003. Pull it in. 1004, 1005, and relax. Very good. Now another thing you might hear from your clients when they're doing this is you might get some spasms in their low back. That's excellent because that's telling you that they're activating that muscle that you want them to activate, which is the transverse abdominis. It runs from the line in the middle of your belly, comes all the way around, fuses into the thoracolumbar fascia, creating that hoop tension. So sometimes they will get spasms back there. That's perfectly fine. You're not hurting anything. Okay, very good. The next exercise is what I call bridge marching. I'm going to take this out here. Alex has his toes loaded, so they're pointed up. Belly button's in tight. Now what he's going to do is he's going to perform a bridge. He's going to pick his butt up. So you're not going to hyperextend. A nice straight line between his knee, his hip, and his shoulder. Belly's in tight. Now we're working on the multifidus muscle. It's an intersegmental muscle between the vertebrae of the back. So what you're working on here is preventing unwanted rotation. Okay, again, core stabilization. So Alex is going to take this leg and he's going to put it up straight, keeping the legs parallel with each other. And he's looking to prevent that hip from dropping. So the hip's going to want to drop like this, and he's going to square it and hold for 2. 1001, 1002. Bend this leg. Now this one out straight. Again, good. Nice and straight with the hips. 1001, 1002. Keep those toes loaded. Leg out. Belly button's in tight. Hold, preventing the hip from dropping. 1001, 1002. And come on down. Go ahead and rest for a second. And you can do whatever sets and reps we have on your exercise protocol. Okay, and that's it for the core stabilization exercises.